So, hi everyone. Very good morning to all of you. And today, in the morning transform session, which we do every day 10 a.m. on the DAMS-eMedicoz YouTube channel as well as on the eMedicoz app, I am Dr. Sumer, and with me I have Dr. Deepthi, and we are going to talk about very important topic. Okay. So before I talk about the topic, I want all of you to let me know in the comment box if you are able to hear us and see us. If you are able to hear us and see us, just give us a thumbs up.
Right. A very good morning to all our dear students, and we hope that every day you show up and you've been trying your best. So, have you been trying your best for the last 2 days? Yes, post exams. Are you trying? Yes or no?
Yes.
Great.
So, today the topic that we have decided to speak to you is very interesting actually. It is going to be about making an educated guess. So, you might ask me, sir, I have studied so many things, and there are people who are studying less and are able to, get through the exam better. So, today I'll tell you about the science of an MCQ exam and how we look at it in terms of probability. So when you look
Yes.
at an MCQ exam, there is a question with four choices. Do you understand that? And each of those choices has 25% probability of getting it right. It is not about an absolute science के बॉस तुझे सारा आएगा पूरा दुनिया में तभी तो टॉप कर पाएगा. It is not like that. It is about understanding the probability. Whenever you look at a question, I'll take my take on it and then I asked Dr. Deepji to speak about it. Whenever I look at a question with four choices, there is always one choice which is obviously not the answer. Like for example, if they are saying this drug will help in 100% of the patient, this kind of surgery will help in all kind of patient, this government intervention is so effective, there is nothing like that. By now we know in healthcare or in medical science there is nothing like 100% thing. So you rule out it immediately. Second choice is also kind of rule outable. We are able to kill it, and most of the time we are left with two choices. So I want you all to tell me in the comment box, if you're left with two choices, what is your probability of getting it right? The probability of getting it right will be 50%. Now 50% is very decent. But every year you will see a lot of students will come and say, sir, दो choice रह गई थी जो मैंने mark की वही गलत थी. You understand? Because when you are at a 50% probability, there is a half of chance that you will pick up the right answer, you will pick up the wrong answer. Now, what I have learned is, and my idea is, that toppers are not marking the answer at 50% probability. At the 50% probability level, they analyze the question, then they go and think about, boss, इसकी question की language में से कुछ मिल सकता है? या although it's a medicine question, can I apply some sense of pathology onto it, or maybe can I apply some sense of microbiology onto it? Just for example, I tell you, suppose there's a question which is inflammatory, so can I apply the pathology on a radiological image like we did in DVT and add a little bit more surety onto the answer and change my probability ratio to 60-40, 70-30, 65-35, and then take the plunge, which is called as the educated guess. So you don't pick up the plunge at 50% probability, you click the answer at 60-40, maybe 55-45. You increase your chances of making a better guess, which is what I call as the educated guess. This is exactly, I feel, I've tried my best to articulate what goes into the head of a topper. This is how they mark the answer in the real exam. There will be questions where they have 90% surety, 95% surety. That is true. They are the toppers. But there will be questions which they are marking at 55% probability, 60% probability. Usually they try to go, maybe even if it is 50-50, they try to find maybe 1%, 51-49, then get to the answer. They improve their probability, they improve their stakes. I'll ask Dr. Deepti to contribute.
Okay, so I have a couple of points to put forward because this I've been talking to everyone, with people who've done exceedingly well, with people who have done average, and people who feel that you haven't done well. And I got down to certain points. And since all of you are so used to mnemonics, I thought, okay, I would tell this thing as a mnemonic, right? So my mnemonic for how to make an educated guess is guess it, right? So the mnemonic is guess it. Do you know what is the spelling of guess it? GUESSIT. Yes, guess it. So, what is the first thing that should be taken into consideration? What stands with G? Do you know? Yes. So, what stands with G is the gut instinct. I have seen a lot of times, especially now that I'm analyzing how you all answer MCQs. When you're stuck with two options, most of you tend to overanalyze it, right? But if I look at the examiner's perspective, they are trying to ask or they are trying to clinch the answer on something which is obvious. But the problem with students is you think, oh, it has come in the exam, it is not an obvious thing. They're trying to ask more into it. No, right? For example, the steroid question that I asked you in my Telegram quiz today, I asked, in what POG are you going to give it? The answer was a standard answer, 24 to 34, because this is the period which we consider as viability to when the lungs are mature. But there were so many others who said, no, ma'am, but we can give it up till 36 also. We can give at 22 also. Yes, you are right. But the definite evidence of the time period between which the steroids work is 24 to 34. We give it beyond 34 because, we don't see any harm. And yes, we give it as, okay, there may be some role. Do you understand this? So the first guess it may G is gut instinct. Usually it works because you people are educated people, you've worked hard, right? So please, majority of times your gut instinct is right. It is something that you've come across previously and it works. I will give the U as well. So the next mnemonic alphabet in the mnemonic is U. What do you think stands with U? Tell me. So what I will say is use the concept of elimination. Use elimination. Use elimination. That is what Dr. Sumer has been talking about, right? Eliminate the other options by using certain words like अरे इस option में तो all लिखा है. Nothing is all in medical science, right? इस option में लिखा है कि the percentages are very skewed. They're saying 90% or 99% of patients will show you this. So again, it's a very skewed option, right? So use the concept of elimination. It usually works out, and in fact, it helps you to avoid silly mistakes. Okay? So I will continue with the mnemonic, but I would ask Dr. Sumer to add something to these two things that I have said so far. So guess it and use elimination.
So I think one of the most important thing that Dr. Deepti has already mentioned, and I'll quickly add it here, is that whenever you see a direct question from your classes, I saw this year. I had talked to multiple students, and बहुत सारे students कह रहे थे, sir, during the exam I got overwhelmed कि this is a NEET paper, and I
Yes.
ignored my gut feeling because of overthinking. So don't do that. So gut feeling, your instinctive answer is usually correct. So try to understand that, but don't get fooled by odd man out. Sometimes you are just doing a lambe wala answer ko instinct maan lo. Don't do that, but instinct is always right. So Dr. Deepti, what is T? Even I am very
What is
curious.
E?
E.
Okay, so the next alphabet is E, and with E comes a very important thing. Again, something that I have been stressing about. The E is always examine the keywords. I have been repeatedly saying this. Examine the MCQ stem for keywords. They will give you what is a better answer between two options, right? For example, age likh diya. And now I know that at 65, we don't come across germ cell tumors. It's likely to be epithelial tumors. Then the other keyword is CA125. I know epithelial has CA, 125 is tumor marker, but it is not a tumor marker for mucinous. So now I could rule out why serous is the answer and why mucinous is not the answer, right? Always examine for keywords. NEET PG will have slightly more clinical vignettes as compared to NESET, and they will be short clinical vignettes, 2 or 3 lines at the max. Please remember what I am saying. Usually every line will have at least one keyword, sometimes maybe two. Club those keywords together and then analyze, is A the better answer or B the better answer. It will help you in further elimination. So that's what is E. Look out, examine the stem for keywords, right? Now, What is the next alphabet? The next alphabet is S. Okay, what is going to come with S? It is something that I said previously, but I want to ensure that you know it as a separate entity. The S stands for strike out the extremes. Okay, strike out the extreme options, which exactly was Dr. Sumer also talking about. So, Dr. Sumer, can you tell them how to assess on striking out the extreme options? Because this is again something which we get caught with. हमें ऐसा लगता है कि यार ये ऐसा लिखा है, इतना बड़ा है, and this could be absolutely the correct thing, right?
Yeah, I think that's a very valid point and very important. Even in my own decision making, and whenever somebody gives me a feedback, and I think all the kids can also use this method even in your own life also. Somebody gives you a feedback, तू बहुत खराब है, तू बहुत 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 खराब है. मैं कहता हूँ इतना नहीं हो सकता, इतना नहीं हो सकता. So I ignore the extreme opinion. कोई कहता है तू बहुत अच्छा है. Sometimes somebody will say तू भगवान है, बॉस हो नहीं सकता, छोड़ते हैं. So once you strike out the extremes, you will find the grounded opinion about your own self also. Similar thing helps in the MCQ also. There will be a choice which is totally extreme. Like I told you, 100% of the patients can be diagnosed by MRI of this. ऐसा नहीं हो सकता, इतना 100% जिंदगी पहुंची नहीं अभी तक. Do you understand? So we have to keep in mind 100 extreme statements. The government initiatives will help 100%. They will take everybody out of poverty. ऐसा सब कुछ बैठेगा नहीं कहीं पे भी ना एग्जाम में. तो एक्सट्रीम ऑप्शंस हटाने से यू आर एबल टू गेट अ लाइक अगर
Narrow
नहीं
out.
समझ आ रहा है, अगर नहीं समझ आ रहा हो, जस्ट ट्रांसलेट दी वर्ड इनटू योर ओन मदर टंग. तो लगेगा हाँ यार ये तो बात सच ही नहीं है. सो यू कैन रूल आउट बाय डूइंग दैट. इट्स अ वेरी गुड ऑप्शन.
Okay, so what is the next S? After striking out the extreme options, the next S that I want you to again remember, stick to common patterns. Okay, stick to common things. Now, this is something that you should hear me out and it should stick to you as well, which is when you are confused, go with what is more common. Please, it always works, I promise. For example, I give you a question and then you tell me, ma'am, is question mein there was inadequate information to say whether it is Turner's or whether it is Swire's. It just said high LHFSH and it just said streak gonads, right? And it was primary amenorrhea. Ma'am, ये तो Turner's भी हो सकता है, ma'am, ये तो Swire's भी हो सकता है. I agree. Yes, it can be this, it can be that, but then the every time the MCQ will not give me all the information I need. That is why it is a competitive exam. So when you feel you have inadequate information, okay, to rule out between two options, you're going to promise to me that you're going to go with the most common thing. Please, please, it's a request. NEET PG is very fond of asking between imperforate hymen, and some of you are confused कि ये transverse vaginal septum भी तो हो सकता है. So if you feel the MCQ did not have adequate information, then go with what? Imperforate hymen. Don't go with transverse vaginal septum. Okay? So please remember this. Most of the times they will give you the keywords, but if it is inadequate information, you will stick to what is common. Is that a promise? You will make it a habit. Is that a promise with everyone? Yes.
नहीं,
Okay.
I'll add a line here. जैसे इस बार ना क्वेश्चन था इनिसेट के अंदर that what is the best investigation to be done if a patient comes to you with ureteric colic. Last year repeat था, and I told you in my class, I think it was told you in the predictor session on YouTube also and DVT also. I told every place I've taught in any mode, live में, DVT में, सब में, कि best to diagnose a patient with ureteric colic will be NCCT. There's no doubt. There's no doubt. Okay. And now the problem is, you are sitting on the day of the exam. You're saying, सर ने कहा तो था, लेकिन यहाँ बेस्ट लिखा है. कहीं मुझे और तो नहीं करना, कहीं मैनेजमेंट तो नहीं करनी. पूछा उन्होंने मैनेजमेंट करना है, नहीं पूछा. They've only asked about what to is best to diagnose. It is straight from your class. Stick to the common pattern. Very important. So, Roditi,
Right.
what about further part of the mnemonic?
Okay. The next is guess it में. The next alphabet is I. Again, a very important thing. कई बार हमें नहीं, it helps if we are able to identify the theme or the topic the MCQ is coming from, right? So I agree that sometimes what you're trying to figure out is this medicine? Is it obs and gynae? Is it physiology? It is not the subject, it is the theme which is important, and it really helps. For example, there was a laparoscopic image in NESET which had big ovaries. And therefore you thought, अच्छा ये तो ovarian cyst भी हो सकता है, ये तो ovarian tumor भी हो सकता है, होने को सब हो सकता है. But the theme of the question was infertility. Do you understand this? Do ovarian tumors present as infertility? No, that's not a general presentation of ovarian tumors, right? What is something that presents as infertility and big ovaries? It is PCOS. The answer was linked to the theme. Now, yes, it was an important keyword as well, but when you are not understanding कि ये कौन सा subject का है, for example, medicine and physiology would a lot of times be integrated. The question is on heart failure. It doesn't matter वो medicine का है या physio का है या pharma का है. If you identify the theme is heart failure and look at the options with that perspective, okay, not कि ये medicine में ये कहा था, physio में ये कहा था, no, forget about that. Because again, in NEET PG, you are likely to have more integration as well between, basic sciences and clinical sciences. So when you have that doubt, don't think of which subject the question belongs to, think of the theme and then take it from there. So if it is infertility, look at the options. Which options make no sense with infertility, right? So that always helps. Dr. Sumer, your take on it, maybe with an example as well.
No, I totally agree, and also I would like to add to it that sometimes there's a forensic question, and you confuse it with a pediatric question or a gynae question. Sometimes it is a straight away a thing from the
Yes,
forensic question,
yes.
IPC or CRPC, and you think कि नहीं सर मेडिसिन वाले सर ने तो बताया था ये ट्रीटमेंट है, वो मेडिसिन वाले सर ने जिंदा आदमी के लिए बताया होगा, वो ऑटोप्सी पे आप पूछ रहे होंगे. Sometimes you miss it. Reason I'm telling you this is that sometimes I have seen a question on, I think there is something which is, there are many things which are different when we look at it from a autopsy perspective versus a alive perspective. So, if you don't see the difference, and also one of the things that I would suggest is this is what I used to use.
No, I
For
also want to give another example here.
in the real exams, the questions are in sequence. So if it is an anatomy question going on, the last three questions were anatomy, the fourth is also anatomy only, or last three were forensic, this is forensic question. So don't get confused and think about कि अरे तो ऑप्स की मैम ने ये बताया था या पीडिया के सर ने बताया था, मेडिसिन के सर ने बताया था, सर्जरी ने बताया
Also,
था.
some things are very, very common. For example, एक टॉपिक है जैसे कि शॉक है ना, हीमोडायनामिक इंस्टेबिलिटी है, उसमें इनिशियल स्टेप इज रिससिटेशन, राइट? अब वो चाहे गायनी एक फीमेल पेशेंट शॉक में हो, एक बच्चा शॉक में हो, एक एडल्ट शॉक में हो. If no more details are given and we're asking you about resuscitation, you should know that crystalloids are always preferred for resuscitation. Yes, it doesn't matter वो छोटा बच्चा है या एक वो फीमेल एक्टोपिक की है या वो कोई और पेशेंट एडल्ट है. So the theme here is resuscitation or shock. So stop going on to नहीं पीडिया में ऐसे बताया था, ऑब्स में ऐसे बताया था, सर्जरी वालों ने ऐसे बताया था. ठीक है? I hope we are making it clear. Some things can be approached with concepts. So when you identify the theme, you will go back to basics and you will never do it wrong. Because कई बार हम आपसे सिर्फ बेसिक्स पूछ रहे हैं, ठीक है? I do agree. Sometimes एक बच्चे में हो सकता है along with ringer lactate आप ग्लूकोज देना चाहते हो, मगर उस क्वेश्चन में कुछ और सेपरेट चीज दिया होगा जिसकी वजह से ग्लूकोज was one of the ingredients. But when nothing is given and we are asking you आप RL से resuscitation करोगे या ग्लूकोज से करोगे, तो I don't think why we should think about कि ग्लूकोज देंगे. ठीक है? So please understand the theme of the question rather than going into overthinking mode. I hope we have made it clear, because these are the things we come across when you see what kind of errors my students are working. Okay, now the last thing in the guess it, the last alphabet is T. This is coming last because वो last में ही आना चाहिए, right? Now हमने बहुत कुछ आपको बताया कि gut feeling करो, first instinct पे जाओ, elimination use करो. What is the last C? लास्ट में मैं बोलूंगी थिंक। कम क्वेश्चंस होते हैं जिसमें आपको थिंक करना पड़ता है, राइट? दे विल बी यूजुअली क्लिनिकल विनियट्स, okay, जिसमें yes you will have to think eventually, only going by your instincts may not work, right? So then yes, but lesser number of questions which will require your overthinking or analysis mode. So बहुत, I always tell my students that nearly 50 to 60% of the paper should come reflexly to you to ensure that we are not overthinking. ठीक है? Yes, in 15 to 20% you may have to use the think mode where you have to, again go back to the alphabets only. Did I identify keywords or not? Yes. Have we identified what theme is it working on? So जो ऊपर वाली चीजें मैंने आपको बताई हैं उनको इकट्ठा कर दोगे and that is your think mode. Dr. Sumeer always talks about this कि अंडर थिंकिंग भी नहीं करना है, मगर द नंबर ऑफ क्वेश्चंस व्हेन यू हैव टू थिंक व्हिच शुड बी नॉट टू मेनी. सुमेर.
So my take on this will be, before we ask Dr. Deepti to summarize the mnemonic once more about the guess it, which is a great method of making a guess in the exam, I will introduce a method of thinking which I follow. That method is called as pause. So when you read a question, that is an action that has happened, before your reaction, there is an pause which gives you the power to choose your response. And that happens in real life also, that happens in MCQs also. So between the action and the reaction, there is a pause in which you have the power to choose your response, your reaction. क्या उस क्वेश्चन को देख के गुस्सा करना है, रोना है? So that is your reaction or your answer. So whatever you want to choose is in that zone, and that is where your power as a human is. And what I've learned is that people who are using the pause method are using their prefrontal cortex or the cognitive brain more often than their amygdala. Try to understand. If you read a question, immediately sometimes you might say, "अरे यार लंबे वाला answer यही लग रहा है." And that is your emotional answer. It is not the real answer. But to get to the real answer, you need to have that pause. So one of the things that I often talk about in my class, I have taught this to, I think, lakhs of students and many individuals, many of our DAMS partners or or our teachers. I've talked about pause a lot. Anybody who has known me in my life would have learned this sometime or the other. Ke boss, I would always say, before somebody says something, before you speak out, pause. Pause is the most critical part of including cognitive thinking versus reactive answering, which leads to silly mistakes. So I'll ask now Dr. Deepti to summarize the guess it method of making a guess in the exam.
And
G for
Dr.
G for
I tell them in the class कि मैं किसी ऑर्डर में चीज पढ़ा रही हूँ और मैं जिस ऑर्डर में पढ़ा रही हूँ उसी ऑर्डर में उसको मार्क करना है. मैं उन्हें बोलती हूँ कि हम बहुत कॉन्शियसली पढ़ाते हैं, ऐसा नहीं है कि जो दिमाग में आ गया वो बता दिया. There is an order, there is a flow, there is the sequence. The sequence is very important, and therefore I will again say, guess it may, it's not just the mnemonic. It is the sequence in which I'm telling you to use things which is important. So what is the first thing that you do in guess it? The G stands for gut instinct. Most of the time,
gut
it is
feeling.
correct. Yes.
What is you? What is you?
Anybody can recall what is you? The next important thing is use the elimination method. Okay, so you is use the elimination. Somebody is saying explain the elimination method again. Okay, fair enough. So let's try and do the elimination method with, maybe an example. For example, let's say the question is about all are causes of IUGR or risk factors for IUGR except. For example, this is what I gave in the, one of the quizzes yesterday. Okay, and in those causes, you could see that three things were very option. For example, one is smoking. Yes, smoking can cause IUGR. Okay, then maybe about the other two options, you were not sure. Okay, so let's say one option is uteroplacental insufficiency. Now that also I know will cause IUGR. Okay, now we are left with, let's say, two problems. Okay, or two options. One is chromosomal abnormalities, one is diabetes, right? Now let's say I am stuck with this. Is it chromosomal or is it diabetes? And maybe I can't understand at this time in the exam how chromosomal will cause IUGR, although it is one of the most common fetal causes of IUGR. But I knew, as far as I have studied, that diabetes causes macrosomia. The characteristic finding with diabetes is macrosomia. So, with the elimination, and I'm not sure about chromosomal, so I am going to go with diabetes, because what is characteristic for diabetes is macrosomia, right? So even if you are confused between two options, try and eliminate based on the basic knowledge you have, right? I hope this helps. Okay,
So,
so
Dr.
you
Diti,
was used
what is E?
elimination.
What is E?
Okay.
Very
Anybody, the
quickly,
third
please.
E is very, 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 very important in the order. The E is, please examine the stem for keywords. So examine for keywords whenever you are stuck between two options. It always helps. Okay.
And what about S?
S was striking the extremes. Options like every patient of this disease will show this. No, medical science में all, every, 100%,
Ever.
ये सब true नहीं होता है. Never, right? These things are not correct. Extremes of percentages, okay? It will help in 100% cases, okay? It will be useless again. So extremes have to be eliminated, okay?
What about
Then
the other?
the other S is stick to common sense. When in doubt, go with what is most common. I promise you will be a winner with this. Okay, I have tried it all my life and it works out. Okay, so when you are confused and you feel the adequate information is not provided, whether it is A or it is B, आंख बंद करके go with what is more common. Okay, right? So that was the second S. I.
And
What is S?
IT.
I is identify the theme. Don't try and identify the subject. If the theme is shock, you go with basic concepts of shock. Don't think about ये medicine में shock हो रहा है या female में gynae में shock हो रहा है या छोटे बच्चे में shock हो रहा है. The theme is shock. Some things will stay if it is shock. You need to secure IV line. You begin resuscitation. खून के बदले में बाद में खून ही देना है, चाहे वो adult में हो रहा हो या छोटे बच्चे में हो रहा हो. Right? So you have to go with the theme. If the theme is infertility, you approach the MCQ as infertility का question and not think यार endometriosis में तो कुछ और भी होता था. नहीं, मगर infertility होती थी कि नहीं? Yes, it is one of the major presentations. Okay, so go identify the theme rather than the subject. It will help you a lot more. Okay, keep you
And the
less
final
confused.
T. Final T, Dr. Diti, final T.
The final T is what I wanted to do in the last. If nothing else works, then think. Okay? Keep it to minimum. No overthinking. Definitely, clinical MCQs will need a little thinking, but in those clinical MCQs, the above alphabets will also be useful. So अगर आप ऊपर वाली चीजें कर चुके हो, gut instinct देख लिया, keywords देख लिया, theme identify कर लिया, eliminate कर दिया, most of the clinical vignettes also become very very approachable. तो ओवर थिंकिंग को सबसे कम करना है, क्योंकि अभी मुझे लग रहा है मेरे बच्चों का ज्यादा प्रॉब्लम ओवर थिंकिंग है, इवन टॉपर्स फॉर दैट मैटर. I hope today's session was useful. I want to keep it in a format where you feel that we are valuing your time. We are adding value to your time. We are helping you in developing the MCQ skill, because मुझे लग रहा है कि कंटेंट आप पढ़ने की कोशिश कर रहे हो, MCQ स्किल में कभी कभी आप परेशान हो जाते हो. डॉक्टर सुमेर.
And finally, you know what? I would end my session from my side today would be number one, you don't guess at final two choices. You guess by adding a layer of more logic towards one choice and change the probability to 50-50 to 60-40 or 55-45 and improve your probability of getting it right. Number two thing that I talk about always is pause. Between the question and the answer, what you are going to mark, there is an freedom that we have as a human to choose. This is written in many books also. Anything that happens to you in your life, between how you react, there is a pause in which you have the freedom. Don't, let go of that freedom. That freedom is how you want to react to it. What do you want to do about it? That pause is the critical thing about being human, being using your cognitive brain. And finally, I would recommend that you use the methods that we have talked about on the CBT that is coming up on 31st. Damn CBT in this INE set had the most accurate prediction of the real exam ranks. The students who were rank 3 were in the same rank in the CBT, rank 5 same rank 37 I met, he had the same rank. So we had the most accurate prediction of the real exam, that how your real exam ranks would be like. So please don't miss out on giving the CBT. And also don't create any regret. A lot of students are asking me, sir, अगर अभी तक कुछ नहीं किया तो आखिरी 15 दिन में 17 दिन में क्या करूं? Then the answer is DVT, DVT, DVT. Please make sure you revise your DAMS DVT. So I hope
Yes.
you enjoyed today's
DVT,
session.
test, revise. DVT, test, revise. Okay, bachas?
Okay, so we wish you all the best. Learn to guess it and don't wait for perfection to arrive. बहुत सारे बच्चे सोच रहे हैं जिस दिन परफेक्ट होंगे उस दिन एम्स में जाके पीजी करेंगे, लेकिन बहुत सारे लेस देन परफेक्ट लोग ऑलरेडी रैंक निकाल रहे हैं. Why not do it now by using the method of educated guess, by using Dr. Deepti's method of guess it?
No, I'm just analyzing my students, whenever I give them quiz, मैं देखती हूँ कि इनका दिमाग कैसे चल रहा है. और जब मैं उनको एनालाइज करती हूँ, मैं कुछ पैटर्न पकड़ पाती हूँ, how they are making errors, and that's how I feel that maybe I will address it. Okay, everyone, so take care and keep guessing it. Okay, all the
Bye,
best
everyone.
and convert your day into a productive day.